Good evening. The Vancouver Island Health Authority confirms tonight 2 deaths at the Nanaimo Regional General Hospital attributed to an outbreak of C. difficile. VIHA also confirms a dozen cases of the disease have now been identified at NRGH. We get more on the story now from our Mid-Island Bureau Chief Jonathan Bartlett, who's standing by live in our Nanaimo newsroom. Jonathan.
Hudson, C. difficile, or Clostridium difficile, is a bacteria that grows in the intestinal tract of people taking antibiotics. This is the 3rd outbreak of C. difficile at NRGH since 2008. This particular outbreak was first identified at NRGH on March 29th. A patient died on April 1st and another yesterday. Both were over 65 years old and had other medical conditions. People showing symptoms such as severe diarrhea and cramping are being isolated from the general population at the hospital. Staff members are wearing gloves, masks, and gowns, and cleaners are using hydrogen peroxide cleaning solutions instead of ammonia.
As if you come into the hospital, you have diarrhea, or even if you don't, what happens with the people with diarrhea is they are put on precautions. So what happens is staff that are caring for them wear gowns and gloves. We look at putting them in a private room or a semi-private room, or being accommodated into a room where there's others with a similar symptoms, so that we're not putting people without symptoms and symptoms together. Okay. Again, I go back to the message of hand hygiene, the very basic message of hand hygiene, of ensuring that you are doing it at all critical times, such as before you eat, after you go to the bathroom, when you come into our hospitals, when you leave the hospitals. It's always good practice to do hand hygiene.
In 2008, 57 people became ill after being infected with the C. difficile bacterium at the Nanaimo Hospital. 3 people died. VIHA says it's too early at this point to tell if the infection has been 100% contained. We'll have more on this story as it unfolds. Hudson.
All right, Jonathan Bartlett reporting. Jonathan, thank you.
You're welcome.